Good evening, everyone. We're going to go ahead and get started. Um, my name is Rafael Florestel Cavalier. I serve as the inaugural Assistant Vice Chancellor for Student Health and Wellness and the Executive Director of the Counseling Center. And I really appreciate all of you for joining in, whether you're participating virtually or here in person. A quick disclaimer for those who are participating online. I know we have live captioning, but there will be a slight delay in the captioning, but it is happening as we are speaking. So thank you all for participating. And my hope today is for it to be a conversation, the start of an ongoing conversation about how we can work collectively as a community to advance health and well-being at UIC. And to get started, this is the agenda for today. We'll start with some introductions, and that'll include myself and my team and some of those who are in the room. Talk a little bit about the State of University Counseling Centers to kind of contextualize what we've been experiencing here at UIC, or at least what I've learned from my time being here. It's been officially just 90 days and 94 days. Talk about where we are now, discuss the proposed role of college health based on kind of this collective perspective for supporting campus well-being, and then talk about how we can get there. And hopefully during our conversation today, there'll be some opportunities for you to share some of your insight. There are some virtual ways to share some insight and to continue the conversation so that we can learn from you and we can start doing our work as the health and wellness colleagues here supporting this campus to help shepherd this change forward. So I'm joined by my colleagues who are leading the Counseling Center, Campus Recreation, and the Wellness Center. So we have Dr. Nicole Brusa, who is the interim director of the Counseling Center. She'll speak a little bit about where we are with Counseling Center services soon. We also have Lynn Thompson, who is the director of Campus Recreation, sitting here with us. And we have Carol Peterson, who is the director of the Wellness Center. So those are that's the mighty team leading this newly integrated space for health and wellness. And I always like to share a little bit about me as well and my background. So I know I'm new to UIC, but I've worked in college health and higher ed for a little over 15 years. And my most significant experience has been in college health, leading health promotion offices and public health initiatives at different institutions. And most recently, I was at Columbia University leading Alice Health Promotion and their public health initiatives team, which is a part of our integrated organization called Columbia Health, which included services like counseling, medical services, disability services, sexual violence response and prevention, insurance, immunization, etc. And a lot of my responsibility beyond providing health education programs and workshops was also to engage in this development of a culture of well-being at the institution, and most recently helping a lot with our pandemic response efforts related to COVID. And throughout my career, my focus has always been to center equity and advancing social justice through every function that I've been in, whether it's been Res Life, student conduct, sororities, and working with sororities and fraternities, or working specifically in health. And that really did drive me to this campus, knowing the diversity of the student population here and the imperative as a minority serving institution to support historically marginalized students. It just felt like the right next step for my career, but also to create this integrated structure for health and wellness in a time when so many college campuses are grappling with what should we be doing to support student mental health and well-being effectively. So with that, I'm going to ask folks, since I know the people online, I know you won't be able to talk with one another, but but these other questions I want you to think about as you're thinking about your primary role at UIC. Just thinking back to the last few years, thinking about the current state of the world. Reflect on how it's impacted the mental health of our students, faculty, and staff, particularly here at UIC. And then also reflect on this question about what successes you've had in supporting students' well-being during this time. And so just as a reminder, this event is a follow-up to the system-wide town hall, and one of the theme for that was supporting student mental health is everybody's business. And so I really am interested to hear what people's thoughts are related to their successes you've had in supporting student well-being. This is not to say there haven't been challenges, but one of the opportunities in learning this community mindset approach and kind of leaning into it is understanding where have there been successes in our community and learning from those successes and trying to find ways to scale those up. So I think for the folks in the room, since we only have if you can talk a little bit about, if you want to share your name amongst one another, your primary role at UIC, and kind of reflect on these questions about how the current state of the world has impacted mental health and what successes you've had in supporting student well-being during this time. And we'll take a moment to do that. Yes, please, please. Okay. Anyone else want to share? Yes. Everyone's just sharing name and reflecting on these questions on the screen here. Yes.
And also, I think sharing that we as faculty have rich, complicated lives.
Yes.
Some of that reciprocally as well.
Very fair. Yes. Thank you. Cool. So we're gonna keep moving forward, and I want people to reflect on these questions as we continue. Those who are streaming, but also those in the room as we continue our conversation. But thank you for engaging with that. So during the registration process, I did ask participants to indicate what they would hope to learn from this space. And of course, everyone was naming things around student mental health. But what was particularly interesting was the ways that people wanted to engage with the conversation, which was actually quite affirming, aligning with some of the objectives for our space today. People want to know about the university plan for supporting student mental health, so I hope I'm able to get at that a little bit. Programs and services available for supporting students' mental health here at UIC. Insight about the newly integrated health and wellness space that includes campus recreation, counseling center, and the wellness center, and seeking opportunities to engage in the campus-wide conversation around well-being, which really speaks to some of the objectives today, which is one, to remind people about that concept of holistic well-being and the interconnection of the student experience to a variety of different stakeholders on campus and the different support structures that are available to them. Really think about the interdependence of all of these different entities, from faculty to staff to those student-facing staff to student leaders, in realizing or enhancing well-being across the institution. And as we share insight about our experiences, as we engage in some different conversations throughout, is to explore some of those opportunities for enhancing connection, knowing that this is the beginning of multiple discussions. And then to express interest and the opportunity to actively engage in the university-wide conversation. So as I shared earlier, there are several factors that are influencing access to mental health services and what students are experiencing that might be exacerbating deleterious or negative mental health outcomes. Of course, we have gone through a pandemic and continue to go through several pandemics and endemics, whether they're communicable diseases or things like the increased tensions around racism and political unrest. That is not only impacting our students, it's also impacting our mental health professionals, both on campuses and also in outside of campuses. And there's also the reality that students are coming to us with very differing perspectives of what it means to seek help, and that can influence the extent to which they will access mental health services or other supports that exist on campus. And so the way that's been showing up not only at UIC but other campuses is this increased demand for mental health services and supports, and not just demand but also increased acuity of what folks are seeing when they're working to provide therapeutic intervention to our students. There's also perceived barriers to accessing mental health services, and that looks like wait times. That looks like feeling like you don't have access to someone who can actually support your emotional well-being. And then there's also the reality that students aren't seeing folks that actually reflect their cultural identities or social identities when they are seeking care. And so with that, I'm naming this because I know as I've gone through my first few months here, what's been challenging but affirming slightly in an odd way is knowing that what we're experiencing at UIC is not unique to UIC, but we do have an opportunity as we integrate this new health and well-being area to actually think from a holistic public health oriented perspective, because I know that's going to be necessary if we're really wanting to respond to some of these contextual considerations when we're designing this infrastructure that we're trying to build here on this campus. So speaking of my first 90 days, what's been really exciting about what I've seen is the level of commitment from so many different entities on campus who are invested in supporting student success and well-being. We have the areas that I oversee, which include the Counseling Center, Wellness Center, and Campus Recreation. And they'll talk a little bit more about their services, just to give you some highlights there. And then there are all these strategic partnerships that were expected to connect to my role, which include like the Neuropsychiatric Institute, Family Medicine, Campus Care, et cetera. And then as I've connected with individuals and different committees and coalitions and workforces and councils, there are so many folks with charges that align with supporting student well-being. The opportunity that we have is to leverage those assets in a more coordinated way. So really trying to build a broader ecosystem of care that leverages, again, all of these different strengths and kind of foci that these different community partners are focused on to have a more robust response towards a shared mission for well-being at the institution. And as we go through the conversation, I'll start the conversation about what that could look like and what processes we might have to go through to really benefit from the robust interest that we have in supporting our students here on campus. But before that, I want to give my colleagues a few moments to talk a little bit about their priorities for this year and some of the ways that they approach their services.
Good evening, everyone. My name is Dr. Nicole Bruce, and I'm the Interim Director of UIC's Counseling Center. So I want to talk a little bit about our approach to student well-being. We use a stepped care model at the Counseling Center, and that's based off a holistic approach that addresses prevention through education, and it ensures that students are getting the right amount of support they need. So what this looks like is a multi-tiered system of programs that seek to meet students where they are while protecting and promoting their autonomy and empowerment. The most effective but least resource-intensive intervention is offered first, and then we can step up based on evidence of that need. So when most people think of mental health and mental health services, they think of one-on-one therapy, traditionally in an office with a counselor. But for this model to work, we really know that that can be beneficial for some students, but that's not meeting the needs of all students. So this is just a brief menu of some of the services we offer that kind of encompass this model. So as you see, we have individual therapy, relationship therapy, group therapies. But we also have things like single session appointments where students can come in for a focal need. We have virtual drop-in spaces where students can come in talk about what's going on in the world, in the community, in their lives, and in a supportive environment. We have peer support groups. We do educational workshops for both faculty and staff. We do mind-body programming. Several times a year, we have different programs that run. So all of this encompasses helping support student mental health where they're at. As we talk a little bit about, what our priorities are and our goals are, is, we ongoingly evaluate our services to make sure that we're meeting the needs of all our students. Because of this, certain programming has come up. For example, we have a new drop-in space for neurodivergent students because that was a need that was addressed based on students' feedback. We're offering some new groups this semester, a Latin A group, a trauma group for women. And we are committed to just promoting our own cultural humility within the staff, increasing our multicultural competence, our commitment to social justice, and kind of removing barriers that can be barriers to access mental health care. And we're just trying to focus on the next year, really just supporting the community of UIC as we embrace this community mindset for mental health by providing support to our students and faculty, and to continue to expand and strengthen our partnerships. As we talked about, there's a lot of resources within UIC, there's a lot of resources within the Chicago community, and the relationships that we build can help us help students in a more holistic way.
Thank you, Nicole. We'll have Carol talk a little bit about the Wellness Center now.
Hello, everyone. Thank you so much for joining us tonight. I really appreciate it. So, the Wellness Center. So what we do is, one of the things that we do is we look at the student from the perspective of being a whole student. We look at the whole person of the student, recognizing that there's multiple dimensions of that person and of that student. And so we use the 8 dimensions of wellness to guide what we do. So when I say the 8 dimensions of wellness, that means emotional, environmental, social, sexual, physical, intellectual, occupational, spiritual. And so all of these parts keep the individual whole and keep them healthy. So the things that are important to students are things that are important to us. The way that we look at the perspective of the student and what we're doing is that when you enter college, you're actually on a journey, especially for those folks who are on West Campus. They're entering into a new part of the journey of what they have to do. And so they need the support and guidance along that journey. And so the guidance that we give for our students is resources, information. And when we're giving information and guidance, that information is not only just about academic support, because that's important from using a wellness lens, but we also give them guidance in terms of life support. What we also do is we do a variety of different things, especially for students on West Campus, recognizing that their schedules are busy. We have communications. We have a lot of different electronic communications that come out to them weekly, not too much, short, easy to read, that are lifestyle tips, that are information to resources. And so all that information is easily grabbed at any time of the day that it works best for them. We also have a comprehensive website that can be accessed. At that website, we have a Take Care page that focuses on just mental well-being. It encompasses a lot of different things. Again, videos, information that can be accessed at any point in time of the day. So we're looking at we do also workshops that focus on helping students in a variety of different ways. We do mini magazines that are great resources for information. We also, our focus is not only just, helping the academic student, it's also helping them to have fun. And so one of the things that we've been doing lately are DIY crafts that have been very popular, bringing students in, allowing them to use a different part of their brain. So fun and food and information and guidance. And so one of the things that I want to talk about is looking at our goals. So our goals like we look at the whole student, and the essence when we're looking at our goals is also looking at the whole campus as a living organism. And our goal is to take care of and cherish or nurture the living organism that is this campus. That means we're putting out a lot of information to hit all the different types of students and populations that are on this campus. One of our goals too is to make sure that we are acknowledging and identifying and meeting the needs of the variety of students that we have. So we're talking BIPOC, we're talking non-traditional, we're talking individuals who are LGBTQ, IQA+. I want to make sure that everybody on this campus is getting their needs met in some way. And so one of those things is that I need folks to reach out and let me know what their needs are. Because what we do on that end is we do research and we develop booklets, we develop workshops, we develop guiding information that helps students on their journey. And so one of the things that I'm asking is that if you can help me know what your journey is, what I can do is to create information to help in that sense. And those are booklets we've created for UIC Police and for international students. So thank you so much. And thank you again for joining us tonight.
Thank you, Carol, and we'll have Lynn come talk a little bit about the campus recreation centers.
Hello, good evening. Thank you for being here. At Campus Recreation, our mission is to provide welcoming spaces that promote physical activity to enhance well-being and support student success. We define well-being as an optimal and dynamic state that allows people to achieve their full potential, and we subscribe to the vision that well-being is a multifaceted goal and a shared responsibility for the entire campus. Some direct opportunities for supporting well-being from our sphere of influence, aside from our traditional facilities, programs, and services that we provide, are include, but are not limited to, Exercises Medicine on Campus, which is an opportunity to create a robust referral system connecting students from healthcare professionals with services in campus recreation to assist students in being physically active. Expanding recreation programs to emphasize mindfulness and exercise, which can reduce perceived stress, anxiety, depression, and negative mood. Providing welcoming spaces and opportunities for students to develop relationships and create a sense of belonging. And expanding our services for wellness coaching and nutritional counseling. And also providing student professional development to over 300 student employees, which Campus Recreation is a large employer of student employees. So with our Recognize Your Potential program for student employees, we have an opportunity to expand and to really focus on all the 8 dimensions within our student employees. We have the ability to connect for financial wellness and occupational wellness and just additional areas with those specific populations. Our departmental goals for FY23 are evaluation and assessment of the usage of our facilities by African American Black UIC students and come up with a strategic plan for intentional programming for that population. Also, I mentioned we're a large employer for students, so we're also looking at marketing and strategic outreach to connect students with jobs that meet their specific needs, and it's a win-win for both situations and creating a better onboarding process for them. So, thank you.
Thank you so much to my colleagues. And one thing I wanted to name as you were listening, you probably heard a robust set of different programs and services that are provided through these areas, and also these opportunities for complementation between the areas that are now to be integrated in this health and well-being space. So, to move along, thinking about this space that I'm in here, but in kind of my role in college health, I've had the opportunity to work in different college health centers, and one thing there have been a few things that have been consistent in terms of the opportunity for what a college health organization can provide to a campus. And one, it's been to advocate for healthy behaviors and reducing barriers to accessing care. And that's not just at the individual level to really encourage health promoting behaviors, but to actually advocate at a systems level to shift the environment in which students are learning, living, and connecting. To be able to prioritize well-being in those spaces. Most of the spaces that I've been in have also focused on prevention and responding to violence and harms that are associated with deleterious health behaviors, whether it's been violence prevention, whether it's been high-risk substance use, but a responsibility through service provision is to kind of engage in that prevention work. And then to build capacity for the individual, community, and organizational resilience. And what I mean by that is not just thinking about resilience in the concept of grit, like to overcome adversity, but to really understand the different dynamics that are at play that might require an individual to be resilient. Looking at those risk factors, looking at those protective factors, looking at those coping strategies that they're engaging in, and then trying to create space to be able to facilitate resilience for individuals who might be in a situation that they might need it, but also as an organization to position ourselves as a learning organization because our communities are going to constantly change. The influences on our community are going to change, and we need to be able to anticipate those changes and be able to proactively create programs, services, and structures that are going to prioritize student well-being. And of course, being a college health entity gives us the opportunity to really connect to the institutional mission, which is to support student learning and development across their life course. So this could be the first time that students have access to healthcare and well-being services as they enter campus. So we have an imperative and opportunity to introduce them to that in ways that are going to support their well-being, recognizing some of the barriers to accessing healthcare outside of the institutional context. And two, kind of coming from my health promotion, background, I've always found the work that we do in college health as educational work. So being able to, in addition to provide that clinical care or provide that program or service, be able to build that capacity for being health promoting change agents in whatever industry they go into, which is why I was particularly excited about kind of the significant number of students who work in campus recreation. So recognizing, that when we're talking about, well-being, we have to think about it holistically. There's often this conversation about well-being and mental health, and sometimes those terms are used. When I hear colleagues, mention that there are mental health challenges or mental health concerns, I usually am interested in kind of what do they mean by that? What is the student presenting with? What is the community member presenting with? Are there different nuanced pieces that we need to think about that might be influencing what that individual is presenting with that could give us insight into how we might be able to connect them to a team of care that might be beyond just the therapeutic intervention? And so, when I think about well-being, I try to theorize this more holistic conceptualization of well-being that includes mental health, but also looks at the physical, the social, the spiritual, environmental, financial, occupational, psychological, and intellectual pieces, because by really identifying how all these different factors and dimensions intersect with one another, we might be able to identify services that can meet students where they are, that might not always just come from the health and well-being spaces, but are working in concert with the health and well-being spaces. And this is not the only, framework for looking at well-being through multiple dimensions, but I think I always try to emphasize the importance of asking follow-up questions about, what a student is presenting with when they're seeking some type of support or are in distress, even if it's psychological distress, because again, there could be a variety of other challenges that they may be experiencing with, and we might have that opportunity to connect them to that support or care to make sure that they are being treated and supported as a whole individual, a whole person. So, thinking about well-being holistically, and there's always, I always think about the socio-ecological model, which really looks at the reality that behavior is developed and happens within the context of an individual's environment, which means that when we intervene or develop programs and services, we need to be thinking about all of these levels, the individual, relationship, community, and societal level. And of course, there are different versions of the framework that go into even more nuanced details about these different levels, but really, when we're looking at the individual, we're just looking at what they're coming with, like they're either preconditions or preconceptualizations or previous experiences. And particularly when we're looking at mental health, someone might have had a previous negative experience accessing care for mental health support, and that's going to influence how they engage with the supports. Looking at relationships, we're going to be looking at their near relationships, family, friends, social connections, and thinking about how those conversations about mental health care might influence, again, their conceptualizations of mental health and well-being. And then there's the community, the environment in which those relationships are happening. So what about our institution might be either facilitating or serving as a barrier to students getting care or support, and how do we kind of mitigate some of those from a system space? And then, of course, the society. We are constantly going through so many things that influence how we operate as an institution, and influence how the different community members here, faculty, staff, and students are experiencing our community that can have impacts on their mental health. And so I want to invite you passively, and there will be opportunities to continue to engage with this, to share some of your thoughts about some of the impacts on well-being at these different levels when you're thinking about the UIC community. So there's a QR code on this slide that will direct you to a Miro board that will allow you to share some of your insight. And this won't be the only opportunity for you to share your insight, because I want this to be an ongoing conversation. But I want you, as we continue to go forward, and think about some of the different factors that might influence student behavior to share some of those thoughts when we're thinking about the UIC community. And if you aren't able to get the QR code here, don't worry. There will be a follow-up email with the links to it. It's actually scheduled to go right after we're done here. So if we're thinking about well-being holistically, and we're thinking about the different levels of influence on well-being, I like to always think about complementing healthcare with a more prevention and health promotion frame. So there is always going to be the need to provide care for students who are in need, and we need to make sure we're orienting those services in ways that are meeting them where they are when they need them. And if we want to address that community, that societal space, we have to think about some of these actions that are required to kind of shift the environment. And that's thinking about what we need to do to create a supportive environment, thinking about ways to infuse health and well-being in our policy. So when we're developing policies and systems at the institution writ large, how are we thinking about what the outcome is going to be, or how is this going to impact their well-being? We have to think about strengthening our community actions. So as I shared before, that we have all of these entities working on student health and well-being in some way. An opportunity to strengthen our community action is to actually identify a common agenda and then work in a coordinated fashion towards that agenda. Not to say we need to eliminate some of those spaces, because different students are going to have different needs, and they're going to interface or connect with our resources in different ways. But if we are working towards a common agenda, we can share information about what we're seeing, and we can use that information to be able to advocate for some of those more setting shifts that might need to happen to encourage health promoting behaviors. And of course, we need to help folks develop personal skills. And this is not just the students as it relates to them developing skills to be well or to engage in health promoting behaviors, but to support our colleagues who are supporting students who might not be health and well-being professionals, but to be able to be humans, to think about students as whole students, and think about ways that they can support a student until they need to connect them to a more appropriate resource. But just knowing that the ways that students navigate campus means that they're not always automatically coming to health and wellness spaces. We need to make sure that those colleagues who are more student-facing or more present to our students have the skills, that have the capacities that they need to support the community. And then really reorienting all of our work towards prevention. And not to say that we don't need to, again, respond to things that are happening in the moment, but I know I've been invited early on in my time here to a lot of spaces thinking about being a part of the student response team, responding to behavioral threats, et cetera, but trying to introduce the conversation of prevention into that space. Not to say they're not thinking about it, but there's the opportunity to really look at our data across the board. What are the patterns in our community, and what might be making these threats okay from a community perspective, and what can we be doing to mitigate that? So if we are, again, working in this more coordinated way, as a collective, as a community, we're sharing information, we're working more coordinated, we're passing students between the different services in ways that facilitate a continuity of care that leverages the power of this broad ecosystem that we have both at UIC and in Chicago. So what do we have? To do that, there's a shift in paradigm, the way we're thinking about health and well-being. So, of course, there are health outcomes. I know I started in HIV prevention work, so we're always thinking about preventing HIV through condom use, or through minimizing the number of sexual partners you're having, or to engage in less risky sex. And that's at the individual level. But that isn't always just that easy to say, hey, you need to do this. We have to think about that person in context and name the reality that engaging in health promoting behaviors is an actual intentional practice. It's a capacity, and you can't just stop there. You also have to make sure you are supporting known interventions, whether they're biomedical, whether they're helping with health education or increasing access to those services. So kind of shifting just from that health outcome, because that's just one metric, kind of like shifting to this broader conversation about capacity. Health is a capacity that one has to practice. And they have to shift from this conversation of clinical work to educational work. So of course we have clinicians providing clinical care, but that is also, again, that opportunity to educate that student about, one, healthcare and how they can engage in this practice across their life course. So it's a critical opportunity that I really try to encourage my colleagues to take when they are serving in a clinical capacity. Even my colleagues who are been in the health promotion space and do wellness coaching, that is education. So really trying to think about some of those strategies that you can use in other parts of the clinical care provision piece. And then thinking beyond discrete health issues and moving towards holistic development. So I remember when I started working in alcohol, tobacco, and other drug prevention in one college campus, my job was just focused on prevention strategies around alcohol and substance use, but I couldn't do that without thinking about that intersection with mental health, that intersection with relationships, and really advocated for a more holistic role that is looking at the intersection between these health behaviors to be able to create environmental strategies to address all of them and at the intersections of those different health behaviors, which required me to leverage a variety of different stakeholders even outside of the health promotion space. And I think at the other level, we have to kind of shift from this individual change space to a systemic change space. So we can always, at the individual level, we can focus on health behavior change. And something that I always thinking about is doing work around sleeping and encouraging students to sleep well and try to create a room or environment where your bed is for sleep and your desk is for doing work. But if you're still getting have assignments due at 11:59 p.m., I'm guilty having taught classes. That is going to, that's going to be a barrier to them getting good sleep. So what is that systemic thing that we can be addressing? What's the root contributor to the barrier to engaging in the health promoting behavior beyond the skill that you need to engage in the health promoting behavior? And that requires that systemic perspective. And then shifting from the just health behavior change to the culture change. And so many campuses I've been on have glorified the stress culture, where you talk about how many different exams, how much you have due. And even especially when I was at my previous institution, I had to do a lot of work to shift the glorification of stress and really think about, what was contributing to that from the student perspective, from the faculty perspective, from the administrative perspective, what we were modeling. Because I remember one of my colleagues shared, it's like it feels like you have to lift mountains, like the mountain over your head, and that's the baseline. And if you're not doing that, you're definitely not doing enough. And then moving from this technical challenge to a more adaptive challenge. So we're not just, again, fixing this one singular issue through some technical intervention that we know is an evidence-informed intervention to support this particular issue, but we need to be nimble enough to be able to be responsive to the different types of needs that we're going to have from our community. And not only just the different types of needs that are based on the social identities that folks bring, but the context within which we're operating that is constantly shifting. So being able to construct a system that is constantly learning, which requires a lot of data gathering. And I'm not just talking about quantitative metrics. I'm talking about all the types of information that inform the way that we practice and using it in a coordinated way to inform how we need to shift and adapt to the ever-evolving context will help us be a bit more responsive to the shifting needs of our community. And I know changing a culture is a process. It's not going to happen overnight. And I think, and even after we have shifted the culture, we're going to constantly be evolving. So one of the things that I believe is going to be pretty critical is for us to get on the same page about what we mean when we say well-being, get on the same page about what our vision for well-being is at UIC, and defining that for ourselves, whether it's using dimensions as a framework, whether it's using our own definition of well-being that's connected to the WHO, the CDC, et cetera. But what does it mean here? And what does it mean? What does it feel like when students are well? What does it feel like when our colleagues are well? What are the types of conversations we're having? What are the questions we're asking when we're developing programs and services and policies and infusing that in our culture? And then once we figure out what that is for us, what our vision is for well-being, and I say figure out because I feel like there are a lot of ideas for what that is, but I think we have to figure out what is that common agenda here as we're working as a collective here. Then we have to assess our organizational readiness for getting there. Like, what is our readiness for change? What are the ways that we're collaborating now? What are there opportunities for collaboration across the different entities that are supporting the community? And how do we get from one level of readiness to the next? And one way to, really assess that is to start engaging with the community. So I've, done my listening sessions and those will continue, but I also know I need to do some more deep dives into the different entities that are supporting student well-being to learn more from you about, again, your successes, your challenges, where you've collaborated, where there've been, successes with those collaborations, where there've been challenges with those collaborations, and can use that information to leverage the role that I'm in to advocate for changes that can facilitate a more collaborative approach to supporting student health and well-being. And also through this engagement, as we, provide services from the health and wellness areas, we also want to learn from our colleagues who are more student facing, what are some of your needs in terms of capacities so that we can create trainings that are going to support you building those capacities to be partners in supporting student well-being. And not to say we don't need to address our services so that when you are referring students to the services, they are getting the support and care they need, but also making sure that you feel confident in supporting students that present to you with the various levels of distress. And of course, evaluate and enhance because we're going to constantly have to learn it at any level. I think we can have a vision, and I think we need to kind of stick to a vision, but we need to be nimble enough to shift to the context that might be influencing how we get to that vision. And so when I think about a possible common agenda, I feel like there's some key pieces given the community that we're in. One, we need to think about the diversity of this campus. There's so many folks from different backgrounds who have had and continue to have differential access to different services and supports. And we have the opportunity to create equitable systems that are going to advance student health and well-being, acknowledging those differential access points. And in order to do that, we could take a more systems and settings-based approach to really advance well-being that prioritizes inclusive community engagement. So really valuing all of the different voices that we have at this institution, the different efforts that are happening at this institution, and really helping them find that connection with one another to reach that more robust solution. And this requires working with stakeholders across campus to really understand and address the systems that contribute to or create barriers to student well-being, because any one entity won't know what all those barriers are. But if we kind of look at it, again, from that system space, we can probably see patterns in those barriers and try to take a more collective approach to addressing it, or a more systemic approach to addressing that barrier. And we have to develop this common agenda for shifting campus culture towards one that prioritizes health and well-being through a student-centered and equity-minded lens. So really, again, centering equity in our discourse, recognizing the diversity on this campus, but also centering student voices so that we can meet them where they are as we create our services and orient them around both prevention and also making sure the students get what they need when they need it. So if you remember the slide that I showed a little earlier, just kind of my anecdotal observation of the campus during my first 90 days, it really, again, we have the health and wellness spaces, we have this ecosystem of care and partners that do support student well-being. There are anecdotal moments or ad hoc moments where they actually connect to support students, whether it's someone referring someone to one service or another, or whether someone's communicating about a barrier that they heard about from engaging with that student. If we have the opportunity to really leverage that ecosystem, like thinking about what those different entities that exist, those community organizations, those task forces, those working groups, those coalitions, those committees, those student organizations, really identify what are the strengths that they bring into this space, what is the work that they've done, what capital do these different groups have, and how do we get them not to collapse their work, but coalesce their work in a coordinated way where we really identify the overlap between our priorities, and use that overlap and what we are knowing about some of the health priority health concerns on our campus to inform what that common agenda is. And then when we have that common agenda, of course, there'll probably be different ways that some of these different entities work to meet those needs, but there are going to be opportunities to engage in more partner-driven action, where we can see, like, there might be the counseling center providing, therapeutic intervention, but if we created this expanded step care model that identifies a variety of different interventions that don't require therapeutic intervention, we can actually build in the services provided by the Campus Recreation Center, the Wellness Center, by our colleagues who are providing different services either through a resiliency center. But one of the things that's happening now is those services are happening, but they're not actually connected in an intentional way. And if they're actually connected in an intentional way, we'll be learning from one another to be able to identify, again, where some of those gaps in access are, and to be able to collect more robust data that can actually show some patterns that we're seeing in our community, to advocate for some systemic changes that can address some of those patterns that we're seeing in our community that could be challenges to student well-being. So I envision really learning about all the different members of this ecosystem and to really support those different members to be able to provide the service that they're trying to provide in supporting community, but also have a bit more advocacy capital at the institutional level to shift the environment. And I see our colleagues in the health and wellness spaces, of course, providing the service that we need to provide when you are connecting students to that care, but also providing strategic guidance and support to be able to help inform, ways that we can evaluate the efficacy of the different mental health and well-being services that we're providing, and making sure we're on the same page about that evaluation, so we can have similar metrics that we can actually show, like, this is happening here. Someone at the institutional level on the steering committee needs to think about a decision that needs to happen to shift the context. And I think one thing to name is that I don't think there's a devaluation of the leadership that any of these groups have already had on campus. I think there have been successes with these groups, and I think there can be even more impact from the successes of some of these groups, again, if they came together in a more coordinated ecosystem. So with that, I actually want to take a moment to have a conversation about some of these questions. Of course, there's another scan here on this slide for you to share some of your thoughts on the Miro board. But I want to reflect and kind of take a few moments to discuss some of these questions about what are some of the challenges here that prevent us from collaborating more closely on well-being initiatives. So thinking about your experience at UIC, what have been some of the challenges that prevent us from working more collaboratively? I want us to reflect on strategies and methods that have worked well at our institution to foster buy-in and collaboration among leadership and various institutional stakeholders. I want us to also think about how our leaders are helping foster collaboration around well-being, and then thinking more internally about what some of the personal commitments you've made as either leaders or stakeholders as it relates to this work to advance well-being. And because I'm always looking to learn, what is a current well-being initiative that you're engaged in or that you would like to engage in that would benefit from collaboration? So if you can reflect on that for a moment, you can share your insight on this. Again, there will be a follow-up email, but I would like if folks feel comfortable sharing their responses to any of these questions that you'd like to be heard in this space. Thank you, thank you. It's always that challenge between the pressing issue and the strategic thought and intentionality behind it. I always think of whenever when I worked in health promotion, colleagues would ask, oh, can you do this 1 hour workshop on time management? And I'm like, yeah, I can, and that's not going to address the issue. But I know that's the emergent need. So I definitely agree with that. Other thoughts that folks might want to share to any of these questions? Okay. Well, for sure, there will be a follow-up correspondence for you to be able to share, because I definitely would love to hear your thoughts on these. So we've talked about the community mindset from a community perspective. I also want to talk about some of the benefits that we could see in working more collaboratively at the individual level. So most campuses I've been on have focus on creating as many programs as possible, and we'll have a variety of different websites that talk about the different well-being services that are available at any given moment. But I know, having engaged with students or even collecting data from students, sometimes that can become overwhelming, because the question is, I know I have all this information. I know that these supports allegedly exist, but I don't know if I need them in this moment. And how do I know where to start, or when to go to this particular service? Or how do I know when you connect me from this service to that one that I'm going to get what I'm looking for? And I think there is this opportunity, when we are, cultivating this integrated health and well-being space and this broader community mindset, to really think about what is the student journey? How does that student move through the campus, and then how do we orient our support structures around that journey? And I think that need is ever increasing, because we have a student population coming in that is having heightened expectations of personalization based on how they are engaging in other spaces. They're even seeking that around mental health and well-being. And I know that requires us not to think about a one-size-fits-all approach, but that collaboration gives us the opportunity to leverage those different touch points that students might interface with as they're coming on campus, but making sure those different touch points are actually connected so that they know what to expect when they connect that student over to that other service, and how are they actually evaluating the efficacy of that service. And also, if we, again, work more collaboratively, we can try to start mitigating some information overload, whether it's from, mitigating how many websites we have about well-being, or I know I've been in a variety of different conversations about how to infuse well-being into orientation conversations, where I've been at one side of the spectrum where we're going to tell you all you need to know about alcohol, substance use, sexual health, and sexual violence prevention, and where to access these services. But that might not be the moment when the student needs to access those services. But in that moment, that's a lot of information, and they're going to forget about it, most of them, until they actually need it. So if we're thinking about, again, what is the journey of that student from orientation to their earning their degree and moving on to the next piece, we can actually develop a more kind of scaffolded approach to get that information to them when they need it, and also make sure we're structuring services or reminding students about services when we might anticipate that need to be there. That will really help us connect students with the right supports when they need them. And then I always love to emphasize, not just because I love talking about data and evaluation assessment, but I know that there's so much value in leveraging the data from, and I would say this at the service utilization space, because again, students are accessing these services and programs through a variety of different modalities, and what the opportunity here is to be able to share that information about how students are experiencing those services, where their barriers to accessing that service, was that service efficacious and meeting their need, and what does that say about the efficacy of that referral network? Like when we connected that student to throughout the ecosystem, did they get what they needed, or did they get what they needed with the fewest clicks possible? If we wanted to parallel it with a website, because I know at a previous institution, we embedded, clinicians, mental health service providers in our medical clinic. as our behavioral health initiative, because we knew that sometimes when students presented for medical support, they also presented with the behavioral health issue. And if we, told them that you have an appointment with a psychologist in the building across the quad, the likelihood of them actually going over there was really low. But when we let them know that there was a psychologist in the room, they can at least have that initial conversation to determine what they needed next. And that's just one example looking at the connection between medical services and counseling. But I do see that there's opportunity for that in a variety of different spaces. And if we can learn about how students are moving through these support structures, then again, we can create those systems that are going to facilitate that continuity of care. And again, another passive opportunity. You will receive these discussion questions later, but I want you to reflect about how do you currently direct students to the resources that are most relevant to their needs, and also reflect on what some of the challenges are from connecting students with resources they need and when they need them. And then really identifying what opportunities exist for leveraging the information we have, leveraging the data that we have, or identifying opportunities for collecting more information to be able to help us know if we have actually gotten the student where they needed to be and gotten them the support that they needed when they needed it. And then sharing that information, sharing it as a collective. So before we lead, I know we are in the last few moments, but I wanted to kind of talk about what's coming up next. So as I shared before, I think there's an imperative to set an institution-wide vision for well-being at UIC, really leveraging some of the charges and priorities of the different entities that are providing supports around well-being for our students. And I know I have an initial conversation with some of those institutional stakeholders early in November, and that group of individuals kind of includes folks who've either built things at UIC, who have been invested in supporting student health and well-being by leading a variety of different committees and coalitions, or have institutional capital, cabinet level capital, to be able to influence change from an environmental perspective at the institution, to at least start discussing what this vision could look like, and then being able to engage the broader community around how we can execute the development of that vision in a way that includes the entire community, or as much community voice as possible. And then through that conversation, start embedding well-being across our institutional silos. So looking back at that ecosystem and those different parts of the ecosystem, and really understanding where there are opportunities to really infuse well-being even in spaces where they don't think that what the work that they're doing is a part of supporting and advancing student well-being. And then, of course, scaling personalized well-being supports for students, faculty, and staff. So really looking at what are some of the successes in meeting students through a healthcare service delivery piece, and how can we really expand those, scale those up, and kind of invest more effort and energy in building those up. And with that, I know we have 2 minutes, but any questions, thoughts, or reactions from the group in this room? Yes.
In my two departments that I work in, we serve primarily professional students and graduate students.
Mm-hmm.
And I think they have slightly different needs than undergraduate students. Some of it, they both have had sort of a track record of success in order to make it to graduate school or professional programs. And there's sometimes an expectation within themselves and maybe within the programs too that they've kind of got it figured out. So I think there's sometimes not the same connection to campus and to campus resources
Mm-hmm.
that there might be, with how we support undergraduate students. But I've just been noticing sort of increasing levels of distress and kind of complexity.
Mm-hmm.
Maybe just like you said, a willingness to verbalize the
Right.
of what they're dealing with. But yeah, so I would just like hear some thoughts, or to make sure that we're considering sort of graduate students
Yes.
as a particular stakeholder group as well. So instead of just saying students,
Yes.
think of like these different groups of students.
Yes. Yeah.
International students as well, like as a subset within
Right.
graduate and professional students, I think, are under particular pressures within the pandemic and
No, no, no. Thank you for highlighting that. I think it's a very important and valid point. I know when I think about that slide where we're talking about impacts on well-being, and we're looking at those different levels, what happens in those different levels, and even at the individual level, is going to look different for different students based on their different identities and locations at the institution. And I've definitely worked on different campuses, but my last one was primarily graduate and professional. And one of the things that I was kind of charged with was building out better supports for our graduate and professional students, because our undergrads had the scaffold of care that included like this very robust student affairs division that we can actually support their development and providing that ecosystem of care, but then really building out this really understanding and learning from our graduate students, including our health sciences students at that campus, to really figure out what would draw them into the support that they needed when they needed it. And one of the strategies that we engaged in that was helpful, because even though it had a duality around it, they were, especially for our health sciences students, was being able to create programs that actually acknowledged and created space for them to engage in their profession. So really kind of building these interprofessional interdisciplinary and professional communities that not only worked on helping that health sciences community or the broader community around Columbia, the Harlem community, but also to think about how you can support one another in this work. But I think it was starting at, okay, what are you here for, and how do I create space to be able to make sure that this goal to prioritize your well-being isn't in contention with that. And as you're building this capacity to support, again, from a health sciences student perspective, to support others' health and well-being, you have to also build those capacities for yourself as well. So I guess the strategy that I would have here is to do exactly what you name Hear From, and learn with what these graduate professional students need, what they're experiencing at those different levels, and be able to advocate for systems, structure, supports, programs, and services that are going to attend to those. And I also know that there may be similarities in some of the issues, kind of from a outcomes perspective, that folks are presenting with. But when we're kind of thinking about it from a more capacity perspective, recognize that those manifestations might look a little bit different, and being able to, again, provide supports that are attending to some of those different manifestations. So I really appreciate you for naming it, and it is top of mind for me as I'm engaging in this work. Okay, I know. Right. So before I want to make sure we have an opportunity to close the full session, but I want to encourage folks to, again, participate in the post-session survey. It's another opportunity to share your insight, your perspectives about what we could be doing as a campus to support student well-being as a collective. Also encourage you to participate and share your insights in some of those mural boards. There will be, again, a follow-up email to those who are in person and those virtually to be able to engage with those, because those insights, again, will help us to learn where we are today, to inform where we need to go to build this collective approach to supporting student well-being. So thank you for your time.